guess we should do an update. Why are we here?
I'm just gonna cry.
Why?
Because, like, this is, like, my biggest fear, having this surgery, and I put it off for so long because of my fear.
But it's really not that bad. You're making it worse in your head.
I know. Well, I don't like my body open.
Do you know,
like places that are supposed to be closed.
Do you know what the chances are that you have a nurse that just had a tummy tuck?
I know.
And
I know her.
Yeah.
I worked with her.
So you had 3 spots opening on the incision,
yeah,
right?
Not a little bit. What, like 1.5 inches, 2 inches?
Yeah.
Which is
they're slowly getting worse.
Yes.
Not better.
Because new spots are opening.
Yeah.
The one on the side is still like ucky looking, but it's healing good. These are like, I think I have so much fluid in me.
Oh, the nurse said it really wasn't that bad of fluid though.
Yeah. But she said, like, she doesn't feel like there's some place that they can, like,
extract. There's not an isolated pocket. It's just general surgery
just
swelling.
Over. But the fluid's dripping out this incision. This one, I haven't noticed. This one, even last night, like, getting into the shower, I noticed, like, what was coming out into the bulb was just dripping
it's
out
the
of
reddish, orangey fluid.
Mm-hmm. But they don't think it's infected, which I was doing that cream from the surgeon's office, and I'm on Bactrim, which thank God, because I can imagine what it looks like if I wasn't on the antibiotic.
Yeah, you probably would have an infection.
Mm-hmm.
Your doctor called the medical center where you had the surgery, and then he's going to confer with a local plastic surgeon.
Yeah.
I guess to refer you potentially to a wound care.
Yeah.
To get better instruction.
Which they do have wound care here, and that's why one of the
reasons. In the
hospital? Yeah. Where the old emergency room is. It's a whole wound care clinic now.
Okay.
There was like several different scenarios. The easiest was somebody was just treated with like the thick honey wound care, and it just took a long time to heal. Somebody else had to have surgery. They had to debride it and then go in, like debride it, clean it out, and then sew it back up. And another person had to actually have, like, she had a seroma, so that had to be open, completely drained out of her, cleaned out, and then stitched back up. So, like, there's so many different scenarios. All I knew was this is not normal. They think it might be the stitches, like I'm having a reaction to the stitches.
Some people, well, which makes sense, because you already had some trimmed.
Yeah.
Or removed completely because they were pushing out. So if your body's rejecting them, maybe they have to take them out. And then that's part of wound care.
I don't think I want them out. I'm not comfortable with how this looks. I'm not comfortable with how I'm healing. I'm kind of mad at my body right now. Like, what am I doing wrong? Like, why?
It doesn't matter. Everyone heals different.
We have like this support group through this surgery center that I came a part of on Facebook, and a couple of the girls have reached out to me, and one of them this morning, she was talking about her YouTube channel, and she's just so sweet, and she said, like, it was just so emotional, like your last video in this, but she said that her friend had opened like this, and so she was just messaging me and was telling me about her experience.
Yeah, well, it's just going to take longer to heal. That's what sucks.
You know what really sucks?
The nurse said it doesn't look bad, it just looks okay. It doesn't look great, but you'll heal. It's just going to take longer. All right, the doctor just left, and I guess we're going to go see wound care, because it seems like, I think it's the best option. Do you?
I feel comfortable going to wound care. I was hoping they gave me a wound care consult. The flat what do you say it was?
Narcosis.
Flat narcosis. I read up on.
It makes sense.
Which they did say it is very common in people that have had an excessive weight loss that has a tremendous amount of fat and skin.
Yeah, because all that skin fat doesn't have good blood flow. And then you're using that skin to try to piece together. It's not flesh that will heal well, which then also makes sense why they did the nitro bid.
Yeah, because they kept saying, like, we need to get blood flow there, because I was purple. And
that wasn't the area of the incision, though. That was like below the belly. They did
put it along that incision line the last several days. Imagine what it would look like if I didn't get that nitroglycerin cream.
Yeah. Well, you could have the whole area of skin around your belly button and everything could be dead.
Mm-hmm.
And that all looks good.
Which that's what I was scared of at first.
They're moving fast. The doctor came back in already, talked to wound care, and we're gonna actually just go there now. Maybe they'll see you. Maybe just make an appointment quickly. We'll find out. There's nothing they can do for you here at the hospital because it's a wound care.
But he was a really nice doctor.
Yes, they all, both the nurse and him.
Like so nice.
2 days later.
So we just got back from the first wound care appointment. Good news and bad news.
Yes.
Good news is it's not horrible. It's just a setback in healing because you're like weeks and weeks from even being able to like go back to work.
Yeah.
And that would be keeper drinking. That noise you hear. It'll go on and on and on and on and on.
And then I'll trip it all over.
So good news first.
Dude,
you can sleep on your side.
Because my surgeon has had 4 weeks on my back. Like I've been pretty much staying in this recliner. Or like last night in the middle of the night I went up to bed. I just needed a different position. However, he said for wound healing, he feels that a good night's sleep is better for wound healing. So if I need to sleep in my side or a different position, just do that.
Next good news, he feels that you should be good to drive in a week, which is the same time frame as the surgeon.
Yes.
So even though this is not healing great, some things are still on like the correct timeline. So you can get up and walk around.
Yes, because I was like, can I please move? Like this is seriously a form of torture just sitting here. Like this is ridiculous.
It's torture for keeper too because he can't jump on your lap.
I know. My belly, I have so much packing in here, like so much. They're doing wet to dry dressings right now, which I am not looking forward to that.
We will show that tonight.
She's like, it's gonna hurt.
Basically debriding, any of the dead skin to remove it, so fresh new skin with good blood flow can take its place.
To keep an eye on the swelling, because if it continues to get bigger, all the fluid, he would have to send me to radiology, and they would have to do a tap to get all the fluid off of me. So hopefully it doesn't get bigger because I don't want to be tapped. As much as I want this fluid off, I don't want to be tapped. And
The bad news,
every week.
It's a setback in healing. Yeah, so it's a weekly appointment for wound care so they can monitor and manage the healing process. We're just doing wet to dry ourselves until further instruction, so a little bit different wound care. So we will show that tonight when we change that dressing.
I'm already dreading it because I know how bad it hurt. Like we didn't have like non-adhesive pads on it at first and it was coming off and it did not feel good getting that every day.
Yes. Yeah, the nurse said it's gonna hurt, but that's what you gotta do. Luckily, I mean, I don't know, you're still kind of numb down there.
So he stuck this like thing in.
Oh yeah, the depth. They measure the depth of the wound, so the worst one, it's basically a Q-tip with measurements on the stick, and it went in pretty deep.
It did go in pretty deep. I was like, yo,
like the
stop.
entire cotton head went in, plus like
some of the stick.
Up to the stick, yeah.
He said worst case scenario, I would have to fly back down to Miami, which I'm not doing, to get a revision to come back because a lot of plastic surgeons don't want to touch somebody after another doctor has already touched them.
Yes.
Going back to Miami is not an option.
If you aren't healing properly, which, we got weeks and weeks of monitoring to even get to that point.
One other thing that he did say that the other emergency room doctor said, apparently my body does not like these dissolvable stitches, so it's trying to push
Them
all
out.
my stitches out.
So this is all something that could happen. Everyone that has looked at it at the hospital and today at wound care said this is not uncommon. It's not the best thing, but it's not uncommon and it's easily manageable. This dude is like begging for attention. But I gotta get back to work and you're going to rest and
Yeah,
I don't know
have
what this dude's gonna do,
a conference
but
call
he will not stop.
that they're like, what the hell are you doing? The question is, once I tell my employer, how long can I work from home? Because from what he said, I am
you're
weeks and weeks away from even being allowed to go back to work.
to do all that walking. So we'll find that out too, but we'll update tonight yet before we end this video. So we'll see you tonight.
Later.
The time has come.
I don't want to do this. All day I've been dreading it.
So this is the new bandaging they put on.
Look how puffy it is. Because I was already bleeding through everything.
That was before they even did this.
Yeah.
So what is this called? Wet to dry?
Wet to dry dressings.
So
I'm not looking forward
we'll
to it.
show you how to put the new dressing on after the shower, but this is how you take. This has been on since
9 o'clock this morning.
9. So it was put on wet, and then it dries all day, and it's supposed to dry to the wound
Now.
and peel off dead skin.
Yes, so like a natural debriding. However, we need to get onto the nighttime routine, so we are doing it tonight. So it's only been like 12 hours, where it's usually 24.
Yes.
So I'm curious how dry it is.
This is also different tape.
Yeah, because the tape is really tearing up my skin.
No, that doesn't feel too good.
No.
That feels pretty stuck.
I don't want to look. Oh.
Does that
Ooh.
hurt? Does the tape hurt?
Oh my gosh, it's so gross. In my unrealistic head, I was actually hoping that maybe it got all better because I didn't see it bleeding through to my underwear this afternoon. This hurts. Ow, jeez.
Wow.
Oh my god, oh my god, oh my god, oh my god. Please don't do it.
If you cannot grab my arm
Okay.
and dig your nails into my arm.
I don't wanna. This is gonna hurt.
You never know. I thought you said it was numb.
Not numb to where before it was ripping it off and it hurt. Ow.
I mean, that's what they said to do. So it's going to pull.
Oh my god, please don't. I need you. Stop it. Ow, come on.
That's one.
Oh, stop. What if it gets stuck to stitches and the stitches come out? Oh my god.
That's a big opening.
Oh my god. Is it open more?
Oh, it's just drier.
What about here? That's now open.
I guess I'll just finish pulling that way.
Ow. Oh. Why does that look so much bigger?
It's pulling the dead skin off.
I don't like it.
So the bandage is off.
Oh.
Now it's time to get a shower. It's pretty bad looking.
Oh.
But he said it could get worse before it gets better. It's gonna look bad. They told you this.
I don't like being open where you're supposed to be closed.
Right.
And it looks like that's even open now.
He said it could get worse before it gets better. That whole area could open.
Maybe we should get a second opinion.
I think we need to get a shower and then redress it every day. And I'll see you in a week. Alright, this is the wet part now. They have these saline bullets, they're called. One-time use. Use it up, throw it away. Basically saturate this fluffy gauze and roll it into a thin line and lay it across the incision. So I just bunched it up over this bowl and squirted the saline solution on it and then wrung it out because you don't want it overly saturated, you just want it wet. So just in a thin row, bunched up like this to cover the whole incision. And then as that dries, it sticks to the dead skin to pull it off. Alright, we'll update after a couple days.
Bye.
Till next time. Last night.